I'm Megan Trainer.
And I'm Seth Brashear, and we're doing an IEC/EDS522 video presentation on Huntington's disease, otherwise known as HD.
The diagnosis for Huntington's disease. Genetic counseling and testing is important in the diagnosis of Huntington's disease. Genetic counseling involves finding out family history of whether or not anyone has had HD. If either parent has had HD, the chance that that individual will also have HD is 50%. In a small number of individuals with HD, 1 to 3%, no family history of HD can be found. Pre-symptomatic testing is used for people who have a family history of HD but have no symptoms themselves. Pre-symptomatic testing can be performed on adults, children, and fetuses in the womb. In the past, no laboratory tests could positively identify people carrying the HD gene or those who might develop HD before the onset of symptoms. Then in 1983, a team of scientists supported by National Institute of Neurological Disorders and Strokes located the first genetic marker for HD. This discovery was the beginning in developing a laboratory test for the disease. Then in 1993 came the discovery of the HD gene. Discovery of the HD gene has led to a direct genetic test to confirm HD and is highly accurate and less expensive. When patients undergo genetic testing, they donate a small sample of blood, then laboratory tests analyze DNA for the presence or absence of the HD mutation. Testing may also require that an affected family member of the individual, preferably a parent, also donate a blood sample to help confirm the diagnosis of HD in the family, especially if the family's history is in any way unclear, unusual, or uncertain. Patients who do exhibit symptoms will also be tested to rule out other possible causes of their symptoms.
Okay.
Other tests the individual may undergo are brain imaging tests, CT scans, such as CT scans, MRIs, and PET scans. These provide images of the brain where there may be signs of shrinkage. Shrinkage does not indicate HD, however, some people with HD show shrinkage in two different areas of the brain, along with enlargement of cavities within the brain. These tests have little, if any, discomfort. The test can come back clear even when a person shows signs of HD, but when evaluated with family history and clinical symptoms, these tests can be helpful diagnostic tools.
Alright, now we're going to talk about the prevalence of Huntington's disease in the United States. There are about 8,100 people in the United States with Huntington's disease. It is considered a rare disease, with about 15,000 more people at risk of inheriting the disease from a parent, like Megan said, at 50%. These figures show us that about 1,550 people are diagnosed with Huntington's disease annually, 29 people per week, and 4 people per day. The prevalence of Huntington's disease is referring to the estimated population of people who are managing HD at a given time in their lives. The incidence refers to the annual diagnosis rate, or number of new cases of HD diagnosed each year.
Huntington's disease is a progressive degenerative disease that causes certain nerve cells in your brain to waste away. One of the most distinguishing characteristics of HD is an inherited disease caused by a single abnormal gene. Huntington's disease is what is referred to as an autosomal dominant disorder because only one copy of the defective gene is necessary to produce the disease. Since signs and symptoms don't typically appear until middle age, a parent may not know they carry the gene until after they have children. According to Mayo Clinic staff, early symptoms of Huntington's disease may include mild balance problems, clumsiness, and involuntary facial movements. As the disease progresses, one of many develop these symptoms: sudden jerks, involuntary movements throughout your body, severe problems with balance and coordination, difficulty shifting your gaze without moving your head, hesitant, halting, or slurred speech, swallowing problems, dementia. Huntington's disease affects about 30,000 Americans.
Alright, and obviously one of the more important parts of any diagnosis are the implications for the person's family. And so we're going to talk about that now. Those with Huntington's disease should exercise regularly because those who do so tend to cope better mentally and physically with their diagnosis. In addition to this, those with HD should also maintain a proper diet and drink plenty of fluids, like all of us should. For those living as a person with HD or living with a person with HD, avoid filling your house with furniture that contains sharp edges. This is because persons with HD in advanced stages cannot control their body movements, and any such collision with a sharp object could cause serious bodily harm. Hiring someone to help with household duties or with the physical care of a person with HD is another option for many families. If you're a caregiver for a person with HD, make sure to take time to relax, because care for these people can be very, very exhausting. Therapeutic recreation and work centers can provide a place for someone with Huntington's disease to interact with others and pursue interests and activities, while also providing home caregivers a break. And in class we've talked a lot about networks of social support, and these therapeutic centers can also be a resource for those people. Some cases of Huntington's disease may progress to the point where friends and family members can no longer provide adequate care. Long-term care facilities can provide a safe and comfortable living situation when living at home isn't a viable option. And to anyone who's watching this and this affects you, we hope this has been helpful and beneficial, and yeah, it's been fun.
Thank you.